Welcome to The Explainer. Today we're talking about a powerful medication for inflammatory conditions called Bimzelx. So if you or someone you care about is navigating an inflammatory condition, you know that new treatments are a really big deal. In this explainer, we're going to cover what Bimzelx is, who it's designed for, and all the key things you need to know before, during, and after you start. All right, let's dive right in. First things first, what exactly is this stuff, and what specific conditions does it actually treat? Okay, so Bimzelx is prescribed for a pretty specific group of chronic inflammatory issues. We're talking about skin conditions like plaque psoriasis and hidradenitis suppurativa, but also different kinds of arthritis like psoriatic arthritis, which hits the joints, and others that focus mainly on the spine. Now, Bimzelx isn't just any old anti-inflammatory pill. It's what's called a biologic DMARD. That's a mouthful, I know, but think of it like a smart missile for your immune system. Instead of just carpet bombing your whole body to reduce inflammation, it's bioengineered to hunt down and neutralize the very specific troublemakers causing all the inflammation and damage. It's all about precision targeting. So the big question is, how do you and your doctor figure out if this is the right move for you? Well, it all starts with a really important pre-treatment checklist. Look, before anything else happens, the single most critical step is having a totally open and honest conversation with your doctor. They need the full picture of your health to figure out if Bimzelx is going to be safe and effective for you. This part is non-negotiable. And when I say the full picture, I mean everything. You got to talk about your immune history. Any allergies, if you have an infection right now, or if you've ever been exposed to tuberculosis. You also have to cover other conditions like IBD and how your liver's doing. And of course, it's absolutely crucial to talk about pregnancy, if you are, if you're planning to be, or if you're breastfeeding. All of this guides the decision. And once you get started, that partnership with your doc continues. You should expect to get regular blood work done just to keep an eye on things. A TB test is a must before you even start. Another big one, get up to date on all your vaccines before your first dose, because this drug can change how your immune system responds. And finally, make sure every single person on your healthcare team, yep, even your dentist, knows you're on Bimzelx. Okay, so let's say you and your doctor decide to go for it. What does using Bimzelx actually look like day to day? Bimzelx is an injection, and usually it's one you can do yourself at home. Following the steps is key. First, you need to let the injector or syringe warm up to room temperature all by itself. Seriously, don't try to heat it up. Wash your hands, and you're almost ready. Super important tip here, do not shake it. Then, just pick a spot on your upper thigh or stomach, and make sure you switch up the location with each dose to give your skin a break. All right, with any powerful medicine like this, we have to talk about the risks and side effects. It's actually helpful to split them into two camps, the serious but rare stuff and the more common, milder things. Let's start with the most important group. These are the symptoms that mean you need to call your doctor or get medical help, like right away. So please pay close attention here. Any sign of a bad allergic reaction, like swelling in your face or throat or trouble breathing, that's an emergency. Same thing goes for signs of a serious infection, like a high fever or a cough that just won't quit. You also need to watch for any signs of liver trouble, like yellowing skin or dark urine. And finally, any big changes in your mood or any thoughts about suicide have to be reported to your doctor immediately. This is the serious stuff. Okay, now let's shift gears and look at the side effects that are way more common and thankfully are usually not as severe. A lot of people taking Bimzelx might feel like they have a cold or get headaches or just feel kind of tired. A little bit of pain or redness right where you did the injection is pretty normal too. Other common things can be some acne, an upset stomach, or even cold sores. Now, while these aren't usually emergencies, you should still tell your doctor if they're really bugging you or if they just don't seem to go away. Whew, we've covered a lot. So after all that, what are the most important things to walk away with? Let's boil it all down. So here's the bottom line. Bimzelx is a highly targeted biologic drug, not some kind of cure-all. Your success and your safety really depend on a solid partnership with your doctor. That means starting with a complete health chat, knowing how to spot those warning signs we talked about, and always following the instructions to the letter.
Think of this explainer as your starting point. The whole goal here is to arm you with information so you can walk into your doctor's office and have the best, most informed conversation possible. Remember, being an active partner in your own healthcare is the most powerful thing you can do.